Okay, so we are at multiple months now of treatment, but we did a placenta graft last time. This time we're going to do a liver porcine, a little more dimension to it. I don't know if it was the debridement. I was frankly a little discouraged at the progress last time because this was the second lay down that we just had, but I was fairly aggressive about getting a lot of the depth of the fibrous tissue right here off. And now, even if I go to the fibrous tissue, the dimension I'm measuring currently, I think we're about 2.7 or so, is looking to me, I'm going to say that's about 2.3-ish. And in the shorter dimension, about, even if I go to that fibrous edge, about 1.4. So that's a good bit of improvement.
Yeah.
We're going to try the Softwave first. Better depth today. We're doing Softwave in a minute, but we're going to try to prep for the...
something used to click.
That's it. That's it. And so this will help with blood flow. And there's something innate about the stimulus that tells the body it needs to heal. So we're going to get this started. You'll see the electrohydraulic impulse just on the outer shell of the wound. Okay, so what we're doing now, we're just scalloping out just this outer edge of fibrous tissue that can be inhibiting closure. And this is a lot less than what we had to do last time. The blood will enable us to put the porcine liver on without having to hydrate it, because he, as we mentioned previously, is putting a lot of exudate into the dressings when they've been changed. Create one layer as opposed to a bi-layer wound, which will enable better acceptance. From Buffalo knows about sponge candy. It has that kind of texture. It crackles a little bit just like the sponge candy, so it's, I would say, almost closer to the sponge candy than a sponge. And it adapts. Yeah, no, the sponge is not a dressing. The sponge is the graft. Lead the graft in, and it's already conforming quite nicely. If the nurse pulls that last layer, if we do this non-stick now, if this non-stick is saturated and we need to change this at 3 days, so be it. Now we've put the regular gauze on as an outer, but you can really see the conforming to the irregular surface of the wound bed with this particular application.